Hello, my name is Nyleen Mendoza, and this is my final presentation on the U.S. Department of Health and Human Services. The U.S. Department of Health and Human Services was established in 1979. It was formerly known as the U.S. Department of Health, Education, and Welfare. When the Department of Organization Act was signed into law in 1979, this separated the Education Department from the U.S. Department of Health, Education, and Welfare, thus prompted the creation of the U.S. Department of Health and Human Services. The organization of this Department of Health and Human Services has programs and initiatives that cover activities serving and protecting Americans through 11 operating divisions, 8 agencies, and 3 human service agencies. The mission statement for the U.S. Department of Health and Human Services is as follows: protecting the health of all Americans and providing essential human services, especially for those who are least able to help themselves. The goals of this agency is to ensure federal responsibility for those programs and ensure the well-being of all Americans. The U.S. Department of Health and Human Services is dedicated to helping all Americans by providing them with services created to assist those who are unable to provide for themselves. Their goals tie in back to their mission statement, which shows that they are for the people and for everyone. So benefits and services that are offered by the U.S. Department of Health and Human Services include enforcing HIPAA, health rights, social services, prevention and wellness, assistance locating providers and facilities, public health and safety, emergency preparedness and response, advancements in research, featured topic websites, and education and training opportunities. Enforcing HIPAA, which is also referred to as Health Insurance Portability and Accountability Act. On this webpage, you can find information about your rights under HIPAA as an individual. There's an option to file a complaint with OCR about any HIPAA violations or anything else that might have happened. And there's also HIPAA guidance for professionals, which has to do with any type of company, business, anything, learning about what their guidelines are for HIPAA, making sure they're in compliance of it, and any activities that may tie into HIPAA. You also have the protection of your civil rights and stuff. Under this tab, you'll learn about federal rights, civil rights that are supported by HIPAA, and they're enforced to protect all Americans from any type of unlawful discrimination. And then we also have environmental justice. Moving forward is the health insurance. On health insurance, you can find tabs for health insurance marketplace. On this page, you can locate and search through other health insurances and be able to find one that is affordable and fits your needs. We also have the Affordable Care Act. You can go on there and look at more information about how that act was put in place and how it can help you. Medicare is also on there. Medicare is something for people who are 65 years and older. However, if you're younger than that and you are disabled or a dialysis patient, you too will qualify for Medicare. Medicaid is health insurance for low-income patients. Then there's also CHIP, which is a children's health insurance program. This is a low-cost health insurance program for families that make too much for Medicaid, but still need that extra assistance. Then you have your mental health and addiction insurance help. So it's a consumer portal to help connect consumers with helpful resources to answer any of their questions and help them locate anything else that they may be looking for. Then we have social services. This is where we find about the unaccompanied children program, any temporary assistance for needy families, supplemental nutrition assistance program, also known as SNAP, Head Start, child support enforcement, assistance with paying for childcare, foster care, adoption, home visiting program. We have the home energy assistance. We have people with disabilities, programs for seniors, assistance for the homeless, and support for military families. These are all services that are offered by the U.S. Department of Health and Human Services under their social service tab. Next is prevention and wellness. You have information on any vaccines that are currently being used to help protect against viruses that now affect us and had at once affect us that we continue to vaccinate against. You also can learn about any nutrition and fitness stuff to help yourself be able to eat healthy and any physical activity guidelines that may be put in place. So we make sure we're getting proper amount of exercise every week and stuff like that. Then you also have your health screenings. This is where you can learn about some tests that can be taken routinely in order to help monitor your health. Then you have your mental health and substance abuse. This portal helps find treatments for mental health issues and anything that you may need to help with your drug abuse. The environmental and youth and your health is your safety and prevention in your workplace, home, and other areas. Healthy lifestyles is where you can go to learn about any and everything that tie into living a healthy life. Assistance locating providers and facilities is used by consumers to help find providers and facilities in their local area. This is very useful if you've just moved to a new area and need to find all the doctors and stuff that are nearby and stuff, because it's important to make sure you're taking care of your health and finding the best providers for you. Then we also have resources for caregivers. This provides resources for those caring for the elderly, seriously ill, or a disabled family member. This gives them a place to turn to whenever they have questions and need answers pretty fast and don't necessarily have someone that's right there that can help them out. Next is our public health and safety. Here you can learn about any food safety, drug safety, medical device safety, and safety from violence and abuse. Under the violence and abuse, it's really useful in recognizing and preventing child abuse and neglect. We can take more look into any domestic or partner violence and any teen violence that may be affecting a home. So moving next is your emergency preparedness and response. On this website, you can find any information on any situations that may be affecting your community or may soon affect your community, such as anything during hurricane season and stuff. It'll give you some information on items you might want to stock up on and anything if you're going to stay, or it will also give you things like places to relocate and stuff, just in case of these types of emergencies. There's also advancements in research. And on this one, you have more information on poverty guidelines. And this tells you about the federal poverty levels, and it gives you more information on the research related to these poverty levels. We have the human subject research protection. This provides leadership in the protection of rights, welfare, and the well-being of individuals that participate in this research. There's the health data community. This is a portal that makes all your health information easily accessible to yourself, researchers, and policymakers. Next is the research at the U.S. Department of Health and Human Services. This is a portal that you can look through and see any research, any statistical information, or anything regarding these types of research stuff going on. The featured topic website is a very important website. It's very useful in that it has all of the links to different websites that any person may be looking to go to whenever they have questions and stuff. This has anything from being tobacco free to the healthcare. You can learn about resources that you didn't even know about. And you can find them all here on the featured topic website provided by the U.S. Department of Health and Human Services. Next is the education and training opportunities. The U.S. Department of Health and Human Services offers multiple training opportunities and any education stuff that may help build a person's skills or help them become more qualified for any job openings or anything that they may need new skills for to be successful. Primary social problems addressed by these agencies. The U.S. Department of Health and Human Services focus on helping low-income individuals. Some Americans are unable to afford their necessities for life due to health issues, unemployment, or any other responsibility that may affect their income. Because of this agency addresses how some families may be at higher risk of obstacles keeping them from succeeding because of the light society puts around low-income individuals. As a society, we tend to look down upon those who may be of lower income. And it's important that we don't do that and we continue to uplift everyone and treat everyone with equality. So eligibility requirements for the services I've talked about earlier range anywhere from your income to how many people live with you and stuff like all in between. Every single service has different requirements. So I provided the websites that you can go to and visit, and they will let you know if you're eligible or not and stuff. A lot of these have online applications, making them easily accessible at home. However, if you're not able to access them at home, you can go to the office and fill out an application there. How the system works for clients. A most recent example of this would have to be the CDC. Right now, during our current pandemic, the CDC has provided many information about vaccines, how this virus is spreading and stuff like that. That is really helpful to us Americans here having to protect ourselves and our community. Some important information that I've learned about this agency is that it helps those who are least likely to have the same opportunities as others. There's no discrimination in this agency. Everyone is welcomed and stuff, and that's a really good thing because it's important to help out everyone and making sure that those who are unable to provide for themselves are still offered the same quality of life as everyone else.